name's Heather, and we are doing trauma assessment scenario number 2. So I'm working in the emergency department, and my patient arrived via ambulance within 10 minutes. They were involved in a motor vehicle accident. They had an ANO times 4, but in extreme pain, and they have a C-collar stabilization. They have one peripheral IV that is placed already in, and she is receiving a normal saline bolus. When the patient arrives, she is screaming that her pain is in a 10 out of 10 in her abdomen, and her vitals are listed right here when we hook her up to the monitor. Before she gets here, the 10 minutes in between, I will activate the trauma team. I will prepare the room with the warm fluids. So I'll have both warm blood and a warm bolus for when she gets here, as well as a warm blanket. And I will don PPE such as a mask, gloves, and eye pro. Then I will, once the patient comes and arrives, she's once again screaming in pain and everything. I will first look for any obvious uncontrolled external bleeding. There is none except for one on her urethral meatus. So when I see that, because there is external bleeding, I will hold pressure onto it. Then I will assess the patient for their level of consciousness, which is still a ANO times 4. As I'm holding that pressure, then I will reassess and see if it is still bleeding, and it is not after holding the pressure. And I will also cover it with a bandage. Then I will get a second person to come and help me stabilize the cervical spine in order to start assessing for airway. So after getting the partner over here, we will take off the C-collar, and then I will demonstrate the opening of using the jaw thrust to look inside the airway. So when I am looking inside, I will look to see if the tongue is obstructing, any loose or missing teeth, any snoring or gargling, or if there's any edema in the throat. Then I ask if there's an advanced airway needed. The SpO2 is at 94%. So because it is at a 94%, I would just get a nasal cannula and put it on the patient to help with her breathing. Since I did an intervention, I will reassess, and her new vitals are low. Which is now says 100%, which is good. So then I will assess for breathing effectiveness. So I'm looking for symmetrical chest rise and fall, skin color, breath sounds, and if they're present and equal, and just the general rate of respirations. On the monitor, it says that her respirations are 30, which are high. So I will go ahead and listen, and they all sound equal and symmetrical and clear. After that, I will move on to the circulation. So once again, I'll look for any uncontrolled bleeding. Look again at the one spot that had uncontrolled bleeding, and it is not bleeding anymore. Then I will palpate both the central pulses and inspect and palpate the skin for their color, their temperature, and moisture. And that is all normal. So now I'm assessing the patency of the IV using a flush, and it is patent. And I'll go ahead and place another IV on this side of the patient and assess for patency and administer my crystalloid. And I will go ahead and hang it up next to the patient. I will then administer some blood, since she did lose some blood. I will administer blood as well as the normal saline. Then I will palpate all 4 quadrants of the abdomen because she says that that is where her pain mostly is. After doing that, I notice that there is some swelling, so I'll go ahead and recommend to the physician to get a CT scan of the abdomen to make sure everything is fine. Then I will inspect and palpate the flanks for injuries, and as well as inspecting the pelvis for injuries. And when I do that, I will press down on both of these and also in the middle, and then put on a pelvic binder. Since she is having abdominal pain, we want to just make sure that everything is covered. So the pelvic binder is going on. And then since I did an intervention, I will go back and reassess the pulses to make sure that everything is still good and looking for any more bleeding. After that, I will check for the GCS rating and her level of consciousness again. She is still ANO times 4. Then I will assess the pupils to make sure, and they look good. They're equal, round, and reactive. I would recommend getting a head CT because she was in a motor vehicle crash and we don't know the full extent. So then I will get another set of vitals, and the blood that we gave her and everything seems to be helping with the blood pressure that was low. And then I will go ahead, check to see if there's any family present or anyone that we need to call before getting labs like the blood gases and the lactate. Then I will put the patient on a cardiac monitor just to make sure that everything is good. And I do not need to insert a NPO or OPA or an NPA because her SpO2 went up to 100 after applying the nasal cannula. Then I will just kind of consider weaning her off of the nasal cannula that she's on because of her SpO2. Then I will attach a capnography just to make sure that everything is going good with that, and assess her pain again. Her pain is down from a 10 out of 10 down to a 5 out of 10, and I will just reposition the patient, make her more comfortable before monitoring the vitals and waiting for the results from both the head and abdominal CT scans, as well as assessing her abdomen frequently to make sure there is no bleeding. So, that's it.